The Doctor's Voice.
Alright, ladies and gentlemen, from wherever you're watching us, this is Lactar Media, and we welcome you to join us in this great interview. You know, in Africa, we have three people, generally, let me say the world, we have three people. These are doctor, a teacher, and a pastor. These three people have great essence in your life. You know, when you go to a hospital, you will need this doctor. You really need to trust the doctor. When you go to church, you need to trust the pastor. When you go to school, you need to trust the teacher. Now, in your line of preference, it depends with how you will trust them. And this has brought about, communication and a dialogue that we really want to dig into. Today, I welcome you to join us as we talk to Dr. JC. This is the first episode in series 1. We will be running the health talk throughout the week and a weekly episode, of course, with me, Lactar David. Karibu sana, ungana nasi kuanzia mwanzo hadi tamati. Doctor, karibu sana ndani ya Lactar Media.
Asante sana Mr. David.
Now, hebu tuambie huwa mara nyingi nakuona sana ukitembea na kifaa hiki. Kazi yake ni?
So kifaa hiki unaniona nayo mara nyingi, hii ndio tunatumia kusikiliza mara mingi kama kuna shida na moyo na kifua. Most of the time is tofauti na kujanga wakati unataka kufanya what we call the physical exam ya mgonjwa. So most of the time we just use it like an item inatusaidia just to confirm the diagnostic ya ugonjwa fulani unafikiria mgonjwa anaweza kuwa kwa.
Alright, asante sana. Daktari, I know you as JC. Now tell us, who is Dr. JC?
Asante David. Kwa majina Dr. JC ni short, but kwa majina naitwa Dr. Jean Claude Nitegeka, medical doctor. I finished my medical school, it was in 2017, where I worked like a medical doctor in my country for 2 years, and then I just arrived in Kenya in 2019, where I just have been given an opportunity just to work like a medical doctor, just to help patient, just to diagnose the patient, to relieve the pain for the patient, and then just to help to facilitate the patient just to become normal compared to the initial status of the patient. So most of the time when we try just to talk about disease, it's like the healing, it's like the state of the human being just to be out of the pain or out of the disease or out of the injury, for which most of the time the human being you need just to feel comfortable, you feel your body without any pain or any issue with your health.
Alright, thank you, Doctor. Now, ulifikiria lini as you were growing up? When did you think of becoming a doctor?
So the time idea ilikujia sana, I remember it was when I was in my first year secondary school. So where I was used just to attend different institutions, where I really liked the way just to help people who were suffering. So that's just pushed that passion in me, and then I just started to have that feeling that at the end of the day, I would just force myself, I would just try to do everything I can just to be able just to help some of the patients who are just suffering, who just need help of a doctor. So that's the time where that inspiration came in me, and then I just try to push up to the time I started just to my medical school.
Now, look at this. Na sasa wakati umemaliza shule, umemaliza kusomea udaktari, umekuja kupata kazi, your first facility where you worked. Now, share with us maybe the common illnesses that you meet in your day-to-day activities. What are some of the common diseases that you register in your facility?
So, in the first experience as a medical doctor, so we really have to deal with many conditions, for which sometimes you have just to deal with some infectious conditions, some of the issue due to the diet, metabolic diseases, cancers, which is very common nowadays. due to the different lifestyle, the environment you are living in. Also, the common disease we want to deal with is the infectious conditions, cancers, hypertension, diabetes, for which we will have just time to talk about every one condition, the symptoms, the how the disease appear, what is the risk factors, most of the time, and then try just to go in deep, just talk to the people, and then try to talk to our community, how we can be able to prevent the disease to occur, and then how can you, to the patient who are already living with the disease, to know how just to deal with it. So in short, if I can just be able just try just to talk about some conditions for which we are dealing with on a daily basis. Some of the common conditions, I can say hypertension. Nowadays, it's a very common disease for which actually we are dealing with in a daily basis. For which the hypertension have the different risk factors, for which sometimes if you are exposed to the consistent stress, and then sometimes our diet is like some food we are just taking, which can just expose us to have that condition. And then sometimes some of the risk factors they say about the high take of salt, most of the time the fats, most of the time if you are just in the diet it contains more fats, can just predispose you to that condition. And then some of the symptoms of hypertension can have, the patient will just come complaining for that persistent headache. For which sometimes the patient will just try to relieve the pain with paracetamol. But you, as a doctor, we need just to find out the real cause of that persistent headache. So anakuja akisema kichwa na muuma, but kwa mgonjwa saa zingine atafikiria kitu ya kwanza ni malaria. But sometimes kama daktari you just need just to think wide, and then unajaribu kuingia deep kuangalia kichwa kuuma si malaria peke yake. So tunasaidia wagonjwa we try just to make them understand the condition, and then the medication they have to take. Apart the hypertension, most of the time we are dealing with diabetes, which is very common in our age. Diabetes, most of the time, it's one of the conditions for which actually you have elevated blood sugar, and sometimes you have the elevated blood sugar, and then it will have some symptoms. Kwa mgonjwa akianza kusikia na feel it's like anataka hiyo kukojoa saa yote, and then sometimes anasikia kukunywa maji kila mara. So and then sometimes mgonjwa ana feel kuchoka, and then mdomo kuwa dry. So for which sometimes tuko na type tofauti ya diabetes, for which most of the time we help patient to discover which type of diabetes the patient is dealing with, and then we help them just to recover, and then to regulate the blood sugar. The another condition I can say which is very common, actually I can talk about cancer, which is one of the, if you just try to go around kwa medias mingi sahi utasikia cancer ya lungs, utasikia cancer ya matiti, and ya chakula. So there are different cancers. So in different episodes we'll be having, so we just try just to go deep in discussion, and then try to see if we can help our community just to understand how the disease comes, how we can be able to treat, and then how you can be able to live with your disease for a quite long time. Because the important thing most of the time it's the acceptance of the condition. So once you know you have a disease, you have a condition, you just unahitaji kukubali kama uko na ugonjwa, and then unahitaji usaidizi wa daktari. So ndio maana mara mingi daktari ana intervene kuelezea mgonjwa ni nini shida ako nayo, and then anamsaidia kumwelezea kwa matibabu yenye itasaidia yeye mwili yake kurudi sawa sawa. Yeah. So apari hizo mtasikia magonjwa iko mingi, malaria, for which we have time tutaongea kuhusu malaria, tutaongea kuhusu pneumonia, which is very common. The other disease yenye iko very common ni ulcer. So mgonjwa iko mingi na inakuja na tofauti, lakini tutakuwa na time ya kwa tunaongelea hizo magonjwa.
Thank you, Doctor. We are moving on. If you're watching us for the first time, enda pale chini, subscribe, and then you will be getting us in the next series, in the next episodes. I have this one question, Doctor. You are now done with your studies, then umepata kazi. Tell us about your very first surgical case.
Thank you, daktari. Experience ya kwanza kama daktari kutoka shule, the first thing inakuanga, the first case inakuanga ni anxiety. So my first case was a cesarean section, for which I was given by one of the supervisor. Just he allowed me just to proceed. So I was not prepared, but the only thing I remember he told me it was, as a medical doctor, you don't need just to be prepared. So you must be prepared for any eventuality, because you are living in a different condition. So your adaptation to the different situation will help you just to maintain the career. So the first time was a CS, for which actually it was a preemie. Mama alikuwa kujifungua mara yake ya kwanza, hakuweza kuendelea na labor. So mtoto akaanza kuwa na shida ya kupumua, for which actually he was just called to decide to deliver mama kupitia CS. So it was my first time. It took quite a long time. It was very anxious. So sometimes you learn just to manage the stress for the first time. So that one most of the time. So we managed just to deliver. It was a baby boy, for which actually I can't remember the weight, but we managed just to deliver a baby, and then the mother was stable, and then it gives you some kind of joy. You feel it's like wow. So actually I can just remove a human being just in the abdomen of the mother, and then the mother and the baby. So it's so anxious. So you feel that joy, and sometimes after this procedure, and then if it's a success, it's really motivated. It excites emotion, and then you feel relief. At least I can be able to help somebody just to have that joy of family. So that's why ikaleta kwa ndani yangu, so hiyo kupenda hiyo.
Wow, that's fascinating. The very first case you can remember in whatever you do, in your career, you can remember the first mandate you executed and it was successful. That's for him. Now, doctor, tell us, in your day-to-day errands, you wake up, go sit in the office, waiting for the patients to come, and then there is this one patient who comes, maybe claiming to have a lot of headache, and they don't know what's happening. And as a medical doctor, you look at them and you really see, like, you can tell, you can tell something is wrong with them. So you suggest a test, which is serious, and then they go to the lab, and then the test turns out to be positive. How does it feel to break this news to such a patient? They didn't come to the hospital prepared for that, but then having prescribed that test and it turns positive, they are really waiting. And how expensive is it to relay this information to such patients?
So I thank you for this wonderful question. In this career, we mostly deal with different. We are just dealing with different patients. And then most of the time, we say that the first contact with the doctor, with the patient, it will define the way you just continue with the approach. So most of the time, before you deliver the information, as you say, the patient was complaining of the headache, and then you need just to find out what's wrong with the patient. So normally, what we do, it's what we call, you try just to find out the really diagnosis. Because the patient will come in complaining for some symptoms, for which you just need to correlate the symptom with the disease you're thinking about. So most of the time, there's a patient who can just come to you, and then because we have dealing with many patients, and then it seems like for you it's a simple disease. For those patients, it's not very hard to deal with them. But there is that patient who comes to you, and then you feel it's like, here we are dealing with the serious issue. So most of the time, you try just to make a conversation with the patient. Try just to take the history from the different consultation, different visits to the different hospitals, and then try to find out the background, the history, the true history of the patient. And then you try to analyze the face, and then how the patient is responsive to you. So most of the time, the breaking the news, it depended on how the patient cooperates. So there is some the patient for which you realize that if you just go abruptly, you just have to deal with it, a very hard situation. And then for those other patients, you take time, you analyze, and then you see how the reaction of the patient is. And then there is those other patients who really understand. It comes to you already, you have the, I can say 50% of the information, but you just want a confirmation. So what you do, you just proceed, you do a diagnosis, and then once you have a diagnosis, you just do some kind of introduction. You just try just to become like a friend to the patient, and then to let the patient be open to you. Kama swali unaweza kumuuliza, unamuuliza ukikutana kuna shida fulani, una feel utakuwaje? The other patient anaweza kukwambia no, ni najua tu. For those
What do you do in that case? They tell you if you suggest and then you see them telling you
mimi najua. So what we normally how we do is so in medicine it's just some it's a very complex system for which you have different departments. So as the first physician, so you need just to consult other departments. So sometimes you ask some social, what we call the psychosocial support from the psychologist, or sometimes you can have some the other. It's like in our facility most of the time we have our pastor is almost around just to help the patient to be prepared for any eventuality. Then before you transmit the information. So the big part of it, you just prepare the patient first, and then from there, how they respond, how the patient responds, and then it will allow you how just now to release the information. But the big part of it, you give the information, but try just to give some piece of solution for which you say it's like ikikuwa hivi usikue si mwisho wa maisha, you can do this, you can do this. For most of the patient, it's some kind of relief. So because already the patient knows that he have this condition, but already you have prepared some piece of solution for which the patient is saying, oh my God, if this can be done, so if the other question the patient will ask, can I survive with this? So that is the main issue. So your job like a doctor, so you need just to build that confidence, give the hope to the patient, and then you propose the piece how the patient will continue just to live with that condition. So most important thing, just you prepare the patient first, and then you can just release the information. And then most of the patients understand, and then some of them can adhere to the solution they have proposed, or the other can become resistant. So for which sometimes you have to keep teaching them how to live with it, and then just finally mgonjwa atakubali kujibu associated with it.
Wow, that's so hard. That's so hard. Now, Doc, tell us about this one surgical case that you will never forget. So far, you were doing it and you're like, God, please do this. This one that so far you will never forget.
I can say, since I'm a doctor, it's like I have that passion, in maternity ward. So most of the cases I have to deal with, those are most of the time the obstetric emergencies, delivery, cesarean sections, most of the time what we call the hysterectomies. So I remember one of the patients, it was a patient who has been done yes, and then she presented a very serious bleeding. And then the patient goes into shock. In that time, as a doctor, you need just to think first. Because the more you delay to decide, the more the risk to lose the patient is better. So in that, we try just to do everything just to keep the patient, but what we call there's that condition which comes after delivery, the uterus is not contracting, and then you have given everything, but the patient is not responding to any medication. So we have been pushed just to go in. The patient was not talking. The patient was already unconscious, and then So the only solution we remained with was just to remove the uterus. And then the hope was very, I can say, it was a minimum of the hope because the condition of the patient was becoming very, very worse. So in that, we decided just to remove the uterus. The uterus was removed. By God's grace, we was able to control the bleeding, and then the transfusion for it was done. And then after some 1 hour, the patient picked up, and then the first word I remember the patient said, it's, "Thank you, doctor." So it's like that, she recognized that she was already where she can't even explain what was happening. So that was the case I can't remember, I can't forget, which actually, up to now, when I just am walking, I just, most of the time, it's always come back in my mind.
Doctor, how does it feel to save life? Most of the times when I walk into this facility, I meet you. How does it feel just to be saving lives? And then you, like, for example, that case, and you come to meet this person one day. How do you feel seeing somebody who went through your hands, breathing, and they're okay?
David, that's a very good, it's like it's a very vibrant sensation. It feels like there is something good you have done. Without any payment, at least you can realize that Mungu alikuwa na sisi. There is that feeling that you have that when you see that such kind of patient, you say, it gives you that motivation. So that's why most of the time I say this career is like, it's more a passion than other benefits, because most of the time you try to put yourself in the place of the relative of that person, and then the life, once you do that, you never get it back. So sometimes once you are called just to do something just that can help to save life, so as a doctor you don't need to think twice. So first you act, more the result will be just good. So that's why most of the time it's a joy just to be able at least to help a patient who was suffering. So the first thing, the reaction the patient will just come to you telling that, "Thank you, doctor," because the patient was just having pain, he was already relieved. So it's like it's really a joy for us just to save life.
Wow. Doctor, how do you balance your work life, social life, and family time? You may be seated comfortably, be having dinner with your family, and then unahitajika kuna emergency. How do you balance your social life and social needs, family needs, and work demands?
It's a very, very hard question, because as a doctor, it's like the time is not yours. Because once you are on duty, then sometimes you can be called just to walk out of the time of work. Because sometimes you can plan your social life and then plan to do other things. But once the emergency comes in, give an example of, like, sometimes you can have an accident. Maybe you are two doctors in one facility, for which actually maybe you have just more than 10 or 20 patients coming with different injuries, so for which the intervention needs just to be done first. So you can't say, because I'm out of my hours of work, I can't go to help. So it's really tricky as a doctor, but most of the time you try just to have some rest a bit, because sometimes the body needs rest. But as a doctor, it's really hard to have, I can say, your personal life most of the time, because of the responsibility you have, because of the decision you have just to make. So sometimes you can't make it out if you are not just in the place. So you need just to go there and then intervene first. So sometimes we try to balance. When you have the free time, you have just to rest a bit. But sometimes as a doctor, it's very hard to say that I can't do this because I'm out of the hour of work. But anytime you're called for support, for help, you just go there, you help, and then other things can be discussed. So social life and medicine sometimes become very tricky. So you have just to have some person who understand you around you and then who understand what you are doing. So in short that.
Wow, wow. Where do you see yourself in 5 years time as a doctor, personally, in your career? Unajiona wapi in 5 years to come?
So in 5 years to come, just I will be a gynecologist, obs-gyn consultant. So that was my passion thing at time in medical school. So I really feel good when I'm in that. But it's really stressful. I'm planning just to go after for postgraduate, doing my master's degree in obstetric gynecology, then be able to help more mothers who have issues just to be relieved, just to be held on. After that, at least they can have their joy in the family, have their babies. And then if you have different gynae condition, can at least be able to help in different manners. Yeah.
All right. So, what is your how is your schedule? What keeps you busy when you're not in work? Mostly Tuesdays are hectic, but then there is this day at least, or maybe when you're off duty. What keeps you busy? Your hobbies? What do you like doing apart from your career?
Apart of my career, also some of the things that keep me busy, I just mostly like the reading, and then sometimes I like just to football, just watch football and then have fun with friends. And then music is one of the things that relieve me first, that make me feel at least relieved a bit. So different music, country music, blues, hip-hop or sometimes, and then help me just to feel a bit relieved. And then some other time, if I have just time, I just read my Bible and then just try to, and then have a time with my family. So I'm a little bit far with my family, but we can talk on this WhatsApp and then we can have some information from them. So when I'm out of the hours of work, I just have time with family, music, football, and other things.
I want you to have a word with this patient. There is somebody somewhere, watching us right now. They have this condition, they still fear going for diagnosis. They fear going to the hospital. One word for them, and then we'll wrap up with a word for the youth.
So, as a doctor, the advice can be, it's like if you have a condition, so I know different condition, there's some stigma which comes with, once you know you have a condition, then you fear that once it's out, so you fear the reaction of maybe the surrounding people, how they will react about your condition. But the one thing that I can tell everyone is that the good thing, once you know that you have that condition, and then you get...
Maybe they are still guessing, somebody... I read somewhere that you are not supposed to Google your symptoms. So like I feel something, but then I just want to relate it, I'm not sure, and I fear going for diagnosis. What is this one word for such a person?
Just go to the hospital, try to find somebody for whom you can trust. Talk to that person, open yourself, and for that one you will be helped. At least you know what is killing you, and then at that time at least you can have a relief from there. The person. You can have a doctor, we have nurses, we have clinic officers. So it's most of the time just take that courage just to leave the house and then go to the hospital, explain what you are feeling, and then from the other side you will just get help.
One word for the youth, Zuira.
So other youth, advice I can give to the youth is that as a young person, your lifestyle will define the person you will be in the future. Because actually, we can think you are still young, but the way you behave today will define your life of tomorrow. So it means that most of the time, our lifestyle, most of the time the lifestyle, everything we are doing just around us, our diet, the time we have just to have fun, sometimes can have some bad impact on our future. So, and then most of the disease we have actually is just due to how we was behaving just when we was young. So that's why most of the time, as a young people, just try to learn how to keep your life safe. Don't expose you to someone that think that can finish your life very fast. So sometimes you need just to keep your safety, your diet safety. You have the time to do your exercise, then you have time just to do everything that can keep your life healthy.
Well, that as a youth, in whatever you do, in your day-to-day activities, remain safe. That is the parting shot from Dr. JC. Remember, you can talk to us on Facebook, on Twitter, Instagram. Our handles are there. Remember, you can also subscribe. You can also subscribe to Lactar Media. We will be bringing to you next episode with Dr. JC, and he will also come with his friends, his other doctors, who can take us through the ailments that we go through day in, day out. So you can maybe suggest to us which disease do you want us to talk about in our next episode. This has been a conversation, the doctor's talk and the doctor's voice, with me, Lactar David.